Hello, welcome. Today we will walk through an hospital management system or practice management system. So I have logged in with an administrator user. So we can see the dashboard. Here we have daily visitors count, monthly visitors count, lab test count, inpatient count, and earnings. We can add more features to this dashboard as required. Now we will see the features available in the system. First we have patients. We have list of patients available in the system. This is all dummy data, so there is no concern of data breach. So we can search the patients through patient name, CNIC number, or any unique identifier number and date of birth. We have export Excel feature. So if we click on any patient, it will take us to the consult, or you can say patient history. Again, this is all dummy data, so there is no issue of data privacy or data breach. So you can see the diagnosis. The green one means this is resolved and all other diagnoses are here. We can add the diagnosis. So I will write arm and you will see all the diseases. So we can select the diagnose here and add the date and save it. It will be saved to this list. And we can set the diagnosis through diagnosis code or name and diagnosis date. Next we have medications. This is the medication list. We can add the medication. We will input the medication name, date, frequency, and other required fields, and this will be added to this list. Next, we have lab tests. So we can see the lab test list here. We can search the lab test through name, date, or delivery date, and we can also upload the document for the lab test. And if document is already uploaded, we can view the document as well. So next we have inpatient module. We have inpatient form, so we can input the information if any patient is going to be admit. And here is the list of inpatients. So all the patients who are admit will be shown here. So we can search the patient through patient name, their unique identifier number, and discharge reason. Next we have slips. So first is the visit slip. So any patient who walks into your hospital or practice, you can generate the slip. It will have the slip number, which is basically your token number, and we can enter the name of patient if a patient does not exist in the system, and if patient is already in the system, we can search for the patient through this list, and if patient is already in the system, we can just select this and it will populate the information here, and we can select the refer to which physician or doctor the patient is being referred. Also, if patients are not covered through insurance, we can add the fee here as well. So next we have lab test slip. Here we can add the lab tests for a patient. Again, we can search for a patient or we can enter the name of new patient. We can select the test here. These tests are already configured in the system. We can configure the lab test from this. So these tests are available in your hospital or practice, and we can also add new tests here. So these will be shown in the lab test slip here. And it will auto-populate the fee of any test, like I have selected test 1, and it will populate the fee. So this is configure lab test. Then we have inventory management. First is inventory items. We can add the items and their price from this page. And then we can add the quantity for these items in this screen. We can select the inventory item and we can input the quantity. Then we have user management, where we have user list. This is the user list. We can add new user from here. And we have roles list here. We can add new role. Then we have adjust fee feature. So if a patient has paid more fee or has paid less fee and on any other date he or she wants to adjust the fee, we can adjust the fee from here. So this was the administrator user. Now I will go to the website and I will log in through a physician or doctor role. So you can see user management is not available to physician or doctor role, and by default the physician or doctor will land to this page, to the patients list, as physician or doctor has to do more with the patients. So doctor role will land to this page. And similarly, we can also configure these menus according to roles. Now I will log in with receptionist role. So the receptionist will land to this list, which is daily visitors list. And you can see the patients feature is not available to receptionist. Again, we can configure these menus according to roles. So this is all about the system. If you have any questions or any comments, you can contact us at the given email address. The address is given in description. Thank you for watching.